I'm going to go ahead and introduce our guest speaker today and just briefly orient you to Maryland BHIPP. I know that we have some repeat participants, so I appreciate you listening to this piece, and thank you for, again, joining one of BHIPP's resilience breaks. This is a series of webinars we've been doing over the last number of months, so thank you for joining us today and for returning. If you've been sticking with us through this series of webinars, we hope you find them helpful. My name is Kelly Coble. I'm the program director of Maryland BHIPP, and am really privileged to continue to join for these series and have all of you joining with us. We're really excited today to have Dr. Ken Tellerman with us to be leading us in this discussion around early childhood development. And we hope that you find this as interesting and useful as we do, and encourage you to use the chat to ask questions and contribute by talking about your experiences so we can learn together about the model he's going to discuss, and then of course to use his expertise to ask questions about any general questions you might have about early childhood development and behavior. He is a resource that we are glad to call on, and I hope you find this useful as well. So I'll briefly introduce Dr. Tellerman and then turn this hour over to him. Dr. Tellerman is a general and developmental behavioral pediatrician who has been in private practice in Baltimore City for over 35 years. He's a clinical assistant professor of pediatrics at the University of Maryland and teaches pediatric residents from Johns Hopkins, University of Maryland, and Sinai Medical Centers during their behavioral health rotations. As chair of the Maryland AAP Emotional Health Committee for over 25 years, he has been involved in multiple teaching programs throughout Maryland, training practitioners in developmental and behavioral pediatrics. He is one of the chief developers of the Grow Your Kids Tree program, which you're going to hear about today, that trains pediatric practitioners to perform developmental coaching during office-based well-child encounters. He is currently piloting the Treehouse, which is a dedicated home-based telehealth developmental coaching program. He is also the medical director for the nonprofit OCHO, Organization for Community Health Outreach, which provides healthcare in Honduras. So again, please give Dr. Tellerman a warm welcome for us. We're really excited to learn from him over this hour and hope you take advantage of using the chat to ask questions and really tap into his expertise. Dr. Tellerman, thank you for joining us.
Thank you. Hi, and welcome to everybody. This is exciting for me to be on today to present our program. And hopefully at the end of the session, people will have a clearer understanding of what the TREE program is and what the Treehouse program is in terms of working with families with young children under age 2. I was asked to give a talk about early childhood development, and what I'd like to do is we'll give a little introductory information about the program, but really spend most of the session talking about what the program entails and how you could actually implement it in an office setting. And it's not advancing. Let's see. Okay, it was working a second ago.
If you just try your arrow, Dr. Tellerman, we'll let you use that to advance.
Yep, it's not letting me advance it for some reason. It was working a second ago.
Silas, I hope you don't mind me.
There we go. Okay.
Oh, there we go. Okay, great.
All right. Yeah. So this program was developed through the Emotional Health Committee of the Maryland chapter of the Academy of Pediatrics. We have been fortunate to have received a variety of funding over the last few years. The TREE program was started about 5 years ago at the time of the various kinds of things going on in Baltimore, and the Freddie Gray incident that sparked Baltimore City taking a closer look at racial disparities. And again, the issue of health disparities and racial disparities has become highlighted during the pandemic. So and we'll talk a little bit about why this program also addresses some of those problems. So there we go. So this is a developmental telehealth coaching program that really looks to promote positive parent-child interactions through talking, reading, and engaging or play. And what we want to do is highlight for parents the importance of those particular activities with their young children. And we also use a developmental narrative that we developed across the domains of motor skills, cognition, and communication that we'll talk about in a second, to convey development to parents in a way that they can easily understand it, and also help them understand upcoming development and how their children are going to be changing over the next few months. The program evolved from the office-based TREE program that we developed, as I said, a few years ago, and with the understanding that pediatric practitioners may be the only professionals that children at this young age see in the first couple of years of life. So this kind of program really kind of falls into the auspices of pediatric practitioners as a first-line intervention. It also augments the role of pediatric practitioners to go past developmental surveillance and screening and to actually provide teaching and coaching and intervention. And right now we're using the program with children aged 9 and 15 months of age, although it can be used at any age for children under age 2. Those are the ages that we've selected to offer the program to parents with children those ages. Again, it helps. It sort of shifts the role of pediatrics from simple screening and surveillance into an actual coaching model, and we'll talk about what exactly is coaching. So why is this important? Well, it's important for a lot of reasons, and particularly it's important for families who live in poverty, because we know that poverty and ACEs are associated with developmental delays and lower rates of kindergarten readiness. So this is a population of people that really could benefit from this kind of first line intervention. We know from the literature, African American children, Latino children tend to receive developmental screening at lower rates than Caucasian children. We also know that even when kids are referred for early intervention services, a lot of them may not get referred, and even those who are referred often don't make it there. So these kids sort of sit, firmly in our laps in pediatric practice, and it provides us with a population that we can kind of reach out to. So what exactly is developmental coaching? So coaching is a little different from counseling in that we want to, facilitate parental self-reflection. And the program really works to try to get parents to think about their child's development. The well-child visit enables us to do that, but because those visits can be quite frenetic and short in nature, it's not always easy to get into this material in any real detail with families. And also the families and parents are often distracted during well-child visits. So doing it as a telehealth visit just to talk about development takes that away. It's much more relaxing when parents are at home with their kids, the children aren't crying the whole time, and we're not busy trying to cram a lot of different activities and agenda into the visit. The coaching platform provides an opportunity for parents to actually try out some new skills and can get feedback from the clinician during the session. And very important, it allows pediatric practitioners to watch what the parents are doing and provide positive feedback. And again, we're talking about, often we're talking about parents who may not be receiving a lot of positive feedback in their own environments, and to have some positive feedback from a professional can be very empowering. It also gives us a chance to informally perform developmental surveillance. So I'm going to dive into exactly what the program is and how you would implement it in the office. This PowerPoint appears, and I'll show you the link at the end, on the Maryland Academy of Pediatrics website, and it's listed under professional resources if anybody wants to pull it up and look at it after the talk. So when we've been piloting this in my office now for a few months, and we shifted to the telehealth model during the pandemic, as many people did, when we started offering well-child visits as telehealth, we decided to take the tree model and adapt it to a dedicated telehealth visit as well. So when I meet with families, we actually use this particular PowerPoint that we're starting now, but we keep it engaged. It's not about the clinician lecturing the parent, but it's about trying to engage the parent in an interactive way. So we start off with some open-ended questions. The first question I like to ask families is, what questions do you already and concerns do you already have about your child's development? And that sort of opens up the topic and engages the parent immediately. And I find that the majority of our parents, even if the children are not showing any real problems, do have concerns about their child's development and really want to be reassured that their kids are developing appropriately. And currently, particularly with all the information about autism that's out there, that comes up all the time in my practice in terms of being reassured that their children are not demonstrating signs of autism. The next question I like to ask families is, can you recall one of your favorite early childhood memories? And I think it's a nice question to ask people, because it gets them to think about their own childhood, and invariably I find that they will talk about an event that occurred in their family, typically with their parents or with their siblings. And it gives them a perspective on thinking back to their own childhood and what kind of stands out. And then we can use it as a taking off point to talk about why creating these positive experiences with their children is important, so that in 15, 20, 30 years, their kids can be thinking about, their early positive childhood memories as well. So the program basically reinforces the concepts of talking, reading to kids, engaging or playing with kids together, and being positive and encouraging. And that's the tree mnemonic. So what I like to do is to talk to the parents briefly about why this is important. And what I like to tell parents is that that by talking, reading, and playing with their kids, they are more likely to develop their language skills early, will be better prepared for kindergarten. And we also know that these kinds of positive interactions help offset the stressors that particularly kids who are experiencing toxic stress can develop, but that playing and having fun together, really builds children's ability to deal with stressful events. So the next question I would like to ask people is, what kinds of fun things do you enjoy doing with your child? And that again gives them a chance to sort of reflect on what they're already doing, and then I listen to what they're doing in terms of, are they talking, reading, and playing with their kids, and is it age appropriate? So we'll listen to what they have to say, and most parents say, I like to read to my children, we play this, we play that, and I'll ask them, what things are you exactly doing with your child already? And then depending on what they say, we can fill in the blank. So, it sounds like you're reading, what kinds of things do you like to play, with your child? And if they're not doing a lot of play things, we'll talk about, how they can fill in that gap. If they're not talking to their child, but they're reading to their child, we can talk about age-appropriate talk. So let's kind of dive into this a little bit more. So the first concept that I like to go over with is the concept of communication with families, the T, the talking, bathing your child in language. We developed the schema of our developmental narrative in a way that makes it easy for parents to really understand how development tracks and the trajectory of where their children have been, where they are now, and where they're heading. So what I like to do is, when it comes to communication, in the first year and a half to 2 years of life, we talk about how babies start by vocalizing, and that's coo cooing and babbling. We'll talk about the next stage for older infants, which is more gesturing and saying things like hi, bye, pick me up, and some parents are using sign language with their children. And then as they approach a year, young toddlers begin to verbalize and start by developing understanding through receptive language, and then expressive language kind of trails a little bit behind. And then we'll stop for a moment and I ask the parent, where in this schema does your child fit in? And that gives us an opportunity to, one, screen to see if the child is doing what's appropriate for their age. And typically, like I say, we've been doing this at age 9 and 15 months. So at this stage, I might expect the parent to say, well, my child's starting to use gestures. And that will lead us to the next step, which is, where do you think your child's going from here? And we can then talk about what's coming up in the next few months, which might include the development of some understanding, receptive language, and starting to say some words. So it gives the parents a way of looking at this and thinking about where their kids are and where they're heading. So when it comes to talk, we'll talk about, what are some ways that you can communicate and talk with your child. So one thing that I like to reinforce with parents is the importance of just using everyday experiences to talk with their kids, so they can do it while they're eating, while they're driving, while they're in the bathtub, while they're having meals together, while they're shopping. So we use this as an opportunity to just use language over and over again. There's a very famous study that many people may be aware of that looked at the 30 million word gap between low-income families and more affluent families, finding that by age 3, there was a huge gap in the number of words that children heard between various socioeconomic strata. So we know that talking to the kids is really important in terms of stimulating development, and that's really an important concept that I like to reinforce with the families. If the babies are young, we talk about parentese, which you mostly probably know. Or if you've had kids or you work with kids, making these high-pitched sounds when babies are infants, and ooh and ah, and having the parent kind of use exaggerated sounds to get their child to attend to them. With our older kids, we'll talk about gesturing, and we'll talk about what kinds of things are you doing to reinforce your child using gesturing? We'll ask the parent at that point to try some things out and gesture with their child and ask them how it feels. And then we'll talk about what's coming up next in terms of their development. The sports announcer approach is something that research has demonstrated is a really nice way of parents stimulating language development in kids. And it involves just narrating what the kids are doing. And it feels very artificial for parents, but we say, starting when your child's really young, use the sports announcer approach so that they start hearing words, very shortly, after birth and when they're young, and you can kind of continue to use it through the first few years of life. So again, if we're shopping in the store, we're now walking down the aisle, and there's some red cans over there, and there's some cereal. And it doesn't really matter if the kids understand what the parents are saying. It's the idea of just using language and words so that it sort of, I tell the parents, starts to get into their brain. And this is an opportunity for me then to ask the parents to try it out, because most parents have never heard of this before. And it feels rather awkward. So I'll ask the parents to try it out, and then we'll ask them, how do they feel about it? And most of them say it feels kind of weird. And I encourage them to keep on trying it, and they'll find that if they just do it over and over again, it'll become more natural over time. But this is really, coupled with talking in all settings, this is a really nice way of getting parents to just, freely talk with their kids and encourage language development. For children that are a little bit older, we talk about one, naming objects for their children, and that can be again through the sports announcer approach. But for children who are at the stage where they're developing receptive language, we talk about show me games and then tell me games. So for instance, I had a family yesterday who had a child that was 15 months of age, whose expressive language is just starting to come in a little bit, but definitely has good receptive language skills at this point. And we talked about playing show me games, show me the bear, show me the book, show me the dog, so that they learn to enhance their developmental skills around receptive language. As the children start to speak more, the parents can then transition into tell me games. And so I told this parent that I was working with yesterday that in the next few months, as your child starts to have more expressive language, you can start to ask your child to point out the objects and tell you what they are. And for older toddlers, talking to children and asking them questions is really a nice way of engaging children in language. For instance, why did that little girl that you just hit cry? And having a kid who's, 20, 22 months, 24 months, start to share and talk about some feelings is a way also to get them to use their communication and language skills. And then we kind of transition to reading, reading together, and how important reading is. Well, our program is largely, kind of based on the data that came out of the Reach Out and Read program, which really 15, 20 years ago really started to reinforce literacy in families and has been quite successful. And what we've tried to do is really tag on the talking and the play part in addition to reading, because they're all kind of important. And the reason I think they're important is because they all lead back to engaging in a positive way. And it ultimately, I don't think really matters whether they're reading, talking, or playing with their kids. As long as they're having that positive interaction, they all come back to the same point, that those positive experiences for children is really what cements their development and kind of catalyzes and facilitates their development. And having that relationship with somebody is really what's so critical in terms of helping the kids move forward. And these are all just ways that they can do it. And parents will favor one over the other. They may be wanting to do all three, but you'll typically see some families like to do one of these over one, the other, and all of them are good. So we offer them all, as an option for the family. So we might ask them, how can you reach your child? And the importance of sitting down with a book and reading in an excited, enthusiastic way, letting kids handle the books. The importance of letting children take the lead is really another concept that we like to reinforce for families. And letting them turn the pages, letting them put them in their mouths when they're little. And sometimes kids will just want to read the same book over and over again. My family yesterday said, should I be bringing books for my child to read together, or let them select the books? And I think it's great for the kids to select the books, even if they're the same books. Parents can bring other books to the table, but I really think the kids are more drawn into the activity if they are involved in picking the books themselves. So that's another concept that we like to reinforce. And just as in speaking, they can start off reading the book. I tell parents they don't have to read every word that's on the page. They can make this a sort of fun, interactive occasion by naming objects that are in the book for their young children. And then again, as they approach a year of age for a young toddler, playing the same thing, show me games. Can you see the ball? Show me the little girl. Show me the dog. And as the children get a little bit older and have more expressive language, they can shift over to the tell me games. What's that? What's that? And then again, as the children approach 2, they may be able to actually answer some questions about the story itself. Why is the little girl in the story crying? And so this is an opportunity, again, for parents to then be asked to read to their child during this coaching session, and we can kind of observe, see how they do with it, watch how they engage with each other. Is the child sitting on the parent's lap so that they can see the book? And do you sense that they have a sort of a nice positive interaction as they're going forward? Is the parent being is the parent comfortable in allowing the child to take the lead and not be overly coercive in terms of how the activity ensues? And then, if this is a parent who reads all the time, I won't ask them their thoughts. But if it's a family that said, I don't really do a lot of this with my child, we'll ask them, how they feel about it. And again, we'll talk about, if this is your child's in the show me phase, in the next few months, start doing more of the tell me games when you read together. The engage part of the TREE program is more about play and doing motor activities and just play activities together. And again, I like to just reinforce for the families that this is really a time to have fun together, even if it's only for so many minutes a day. Everybody's busy. We all have busy lives, but it's really important, I think, to reinforce for the families the importance of spending some time daily, or even a couple of minutes, several times a day, to have these kinds of opportunities to engage together. What's nice about the telehealth approach is that for this kind of session, as for well-child visits, we can also bring in people who may not be at the same location. So for maybe one parent is at home and working from home during the pandemic. Maybe another parent is at work and can be involved through the telehealth visit. Maybe there's a grandparent, living in a different location who can join in. So this is an opportunity to bring everybody in together so they all learn this together. Could also be their child care provider could be involved in the session. So there's all kinds of creative ways to draw people into this. So the next question I'd like to ask is, after we've talked a little bit about talking and reading, is, what kinds of fun things would you like to be doing with your child in the next few months? And essentially, how's your child going to be changing? So we talked next about engagement through motor skills and through cognition. When I teach parents about their child's motor skills, we like to use a very simple narrative, which is basically child development in the first year of life essentially evolves from head to legs. And some parents, will look at me like, and you can see that the light bulb went on for the first time. It's sort of like, oh yeah, that makes sense. I'll have parents who say to me, why is my 3-month-old not, sitting up or crawling yet? And this is an opportunity to talk to them about, well, in the first few months of life, most of your child's development will be in their head, neck, and arms. So they'll be reaching for things, developing head control, etc. And then in the next few months, they'll develop truncal abilities. So you start to see children roll, and then they can sit, and then they start to crawl, which is the transition to using their lower extremities. And then you parents begin to understand how the motor process is developing. And then we can talk about, again, where does your child fit in to this schema, as we did with our communication skills, and where is your child going next? So the parent I had yesterday was saying, my child's walking at 15 months of age, they're starting to run. So our next step would be to talk about, things that they can do to engage their children's motor activities. For young children, tummy time is a good thing. But getting babies and children to use motor activities can be stimulated by basically putting things out of reach and having them sort of move towards them. For older children, playing chase me games. So we talked about have this particular child who is 15 months of age, how they could be going up and down stairs and making that a game. If they can go find a playground that's open, using the sliding board to climb up, and just kind of running around outside when the weather's nice and playing chase me games, all is a way of stimulating development. If the children are really young, you get a child to roll over by putting an object, just out of reach, or if they're starting to crawl or walk, again, stimulating the kids by putting something just out of reach that they can move towards, and again, trying to make it fun. This is my favorite part of the narrative that we've kind of been working on, which is teaching parents about cognition in a way that, again, makes sense. What's nice about this processor-oriented approach to development is that it doesn't really focus specifically on milestones, because most parents really aren't thinking about their children's development through a milestone perspective. But they're, they don't want to know how many blocks their children should stack at a certain age. This is really takes it into a different kind of realm in terms of what's going on with the child at a specific age. So we talk about doing things with objects in young infants. And what does that mean? It means that most young babies pretty much explore the world largely through their mouths. And the objects, no matter what you hand them, are going to indiscriminately be placed in their mouth. And that's kind of how young babies are sort of learning about the world. But between 6 and 12 months of age, we start to see babies develop more interest in objects, and we talk about doing things to objects, which is experimenting with objects. So now objects themselves have intrinsic interest. So if I hand a baby who is a few months old a rattle, they're going to put it in their mouths. But if I hand it to an 8 or 9 month old, they're likely to shake it and experiment with it, drop it on the floor. If we give them little pots and pans to play with, they'll bang on them. If we give them blocks, they can put them in and out of cups. So the kids are actually finding that objects around them are intrinsically interesting. But around 12 months of age, they tend to phase into the next stage of cognition, which is that objects have some functionality and that you actually can do things with objects. It's not just simply that, you can experiment with them. So I like to use, pre-pandemic, we would demonstrate development to parents in my office by using a pop-up toy, which I hope one day we can take out of hiding and use in our office again, but right now it's been put away. But the point is that a pop-up toy, those little plastic toys where you press on a button and a little figure jumps up, if you give it to a 9 month old, they might swat at it, but they're not going to really understand that it's something you do something with. But around 12 to 15 months of age, we see that they develop a sense of functionality, that this is a toy that you can actually do something with, and the kids will try to make the little objects pop up. We then can encourage the parents to get objects, for the children to play with that have functionality. So little puzzles, stacking rings, wooden blocks that they can stack, because now the children are beginning to understand that. So, and then the next stage would be between 18 and 24 months of age, is where children start to develop imaginary play. So again, if I have a parent of a 9 month old, I'll ask them, where do you think your child fits in? Are they simply putting everything in their mouth? Have they started to experiment with objects? And then I'll let the parent kind of describe what the kids are doing. And then if I want to talk about where their 9 month old is going to be heading, I'll be talk about functionality. And so over the next few months, you may want to have more toys around that your child can actually play with that have function. And then if the child's 15 months of age, we'll talk about are they using their toys functionally now? And in the next few months, as they develop imaginary play, what kinds of things can they do with their children to facilitate their child's imagination? As an aside, very interestingly, since we're all looking to screen for autism, we had one child in my office a year or two ago who was 15 months of age, and I handed them a pop-up toy, and the child, who seemed perfectly appropriate up to that point, started to smack at it in a very kind of disorganized way. And it just really raised some red flags because they were just using the object in a way that was just atypical for a child that age. We brought the child back a few weeks later just to make sure that that wasn't just an atypical event. And the child continued to show some unusual activity, was still pre-verbal, but was just, their play was just really erratic and flat and inappropriate. and that child turned out to have autism. So using these kinds of toys is a step-off point for also developmental surveillance, as I said earlier. I like to reinforce for parents that it's important to let their kids take the lead. If they're playing with the pop-up toy or they're stacking the rings, the parents should sort of sit back, engage their children, have fun together, but let their kids do it and not do it for them. All right. So again, when we talk about what to do with a young child, for a young baby, we'll talk about, having safe things that they can put in their mouths. For an older infant, we'll talk about having balls, blocks, cups, pots, spoons that they can experiment with, let them drop them on the floor. For a child that's a young toddler between 12 and 18 months of age, we'll talk about having puzzles and blocks and stacking rings, Legos that are the appropriate size so they don't choke. And then for an older child, we'll talk about using imaginary play, stuffed animals, toy figures, puppets, cars, dress-ups. And that's what we talked about yesterday with my 15-month-old, was how she might want to start to think about isolating things in the home that she can use for imaginary play, cardboard boxes that can be turned into a kitchen or a playhouse, those things. One of the things I like to reinforce with families is, that these objects don't have to be really super expensive. They don't need to have to be battery operated. They don't have to have flashing lights and make all kinds of weird noises. That very simple things can really engage the children. And I like to tell the story of my daughter, who's close to 40 now, but when she was a young toddler, her favorite object for a period of time was a ping pong ball, because it was easy to play with. It rolled, it bounced, and she could chase it around, and it cost 10 cents. So it does, kids can be engaged with objects that don't require high costs. Particularly if we're going to focus on families that are in the low income brackets. So again, this would be an opportunity, since the children are at home. Typically during these sessions, we either have the parents sitting at a table with their child and or sitting on a floor together. I do ask the parents, when we're preparing them ahead of time, to have some toys and books around if they're available, to use during the session. It's also telling if they don't have any books or toys around that they can use, in terms of giving us a little bit of clue into what's going on in the family, and the degree either of poverty or their lack of information about what's appropriate for young children. So that's helpful as well to have that insight. So we'll ask the parent to play with the child and just sort of see, what kinds of things, how do they do it together? Do they let their child take the lead? Are they talking to their child during play? And we'll ask them, again, what stage is your child in, and how do you feel about, what you're doing right now? I also like to just make sure that the parents don't forget to sing and dance with their kids. Although most families do that, it's just nice to sort of raise that as another way of development, having fun together and providing a developmentally stimulating environment. So I'll ask them, do you have a favorite song that you like to sing with your baby, and can you sing it together now? And, we've gotten some really cute renditions of kids playing and singing with their parents. And yesterday I got to witness Itsy Bitsy Spider with the parent. And, but it also, again, tells me that the child has good receptive language skills, and I can see, how they're developing. So it provides an opportunity for a little bit of developmental surveillance. And then we kind of wrap up with social emotional milestones. One thing that's important is not to overload families. So if I feel like the family is taking all this in, we'll continue. If I feel like, I've saturated them and that they're sort of losing interest, then, we don't have to cram everything that's in this into the session. But if I have a family that's engaged, we'll talk a little bit about stages of social emotional development. And I like to talk about it from, from the perspective of social smile as the first sign of attachment and the first real social emotional milestone. And then we talk a little bit about stranger anxiety. And I ask the parents, again, if their child's 9 months old, is this something that you're witnessing? Then we can anticipate the next stage that they might be witnessing down the line is going to be separation anxiety. So we prepare parents for that. If the child is 15 months of age and is already in the heart of separation anxiety, which this child yesterday was, then I prepare them for the next stage, which is the autonomy stage, and being prepared for some oppositional behaviors. The other thing that I think is important to highlight is joint attention and joyful play. When I watch kids play, I really want to see them play in a exuberant, enthusiastic way, and I want to see them having fun. If I see a child play that's very flat, they're not interacting with their parents, there's no joint attention, and joint attention again would be having the child typically try to draw the parent into something that they're doing that they experience as fun. So if they're reading a book together, we might see the child get excited by something they're reading and then turn to the parent and then turn back to the book to draw the parent in. And kids who are autistic may not display joint attention. So it's from a developmental surveillance point of view, a good thing to observe, but it's also something that I want the parents to sort of be watching for as well. And again, we talked for a few moments about where their child fits into the schema of social emotional development and where they're heading. And the last part of this is encouragement. And most parents do this naturally, but I do see parents who are very negative with their kids and are sort of yelling and impatient with their children. So I think this is an opportunity to really get parents to be positive with their kids and give them some positive feedback when the kids are doing things, that are appropriate and when they've accomplished something. So being the child's cheerleader. One of the things I like to look for that tells me that kids are getting lots of positive feedback at home is if they do something in my office, they often will then applaud themselves. And that's kind of a cute way of my getting some insight into the fact that the child has had people applaud them in the past and is getting that kind of positive encouragement. So I always feel better when I see that. So, and then I'd like to wrap up the session by asking the parents, what did you find helpful from our session? Can you tell me at least one thing that you learned today? So I'd like them to come away with at least one thing. So yesterday's parent, they might talk about, I never heard of the sports announcer approach. The parent yesterday told me that they didn't know anything about joint attention and they thought that was really interesting and that she would be really watching for that more carefully going forward. So we'd like to sort of, get some input from the families to see that they were engaged. And then I like to say on a 1 to 10 scale, what school say, 8 or 9, I'm happy if they say, I don't know I'm going to do any of this, and I would like to ask them then, what would hold you back from doing that? And then I always like to ask them if they have any other questions that we didn't address during the session. And that's pretty much, how this would work. Can we bill for this? The answer is yes. So if you're going to spend 20, 30 minutes with a family, these are the codes that we have been successfully using. Now, in my practice, I've had private insurance pay for these using these particular ICD and CPT codes. If people want to take a picture of this slide, if they're going to try this out. I don't have any feedback to date on Medicaid patients, although we have Medicaid patients in my office. We haven't submitted any of those for reimbursement as of yet. But we are going to be working with the state to ensure that Medicaid pays for this programming as well. We also have developed an Emr template that can be used, to document the visit. That's basically a checklist of the things that we engaged in during the coaching session. So I have something to refer back to. So when the child comes in for a subsequent well child visit, I can look and see what we talked about at this a telehealth coaching session, and also provides documentation for insurance reimbursement. So just some general tips. The program is really not etched in stone. It's very flexible. And again, trying not to cover more material than we feel parents can handle. And people should feel free to put their own sort of personalities into this and add their own things. And I would be interested in getting feedback from people around, things that they've done creatively if they're using this program to engage families. Since we want to make this available to as many families as possible, but it's reasonable to prioritize families. So again, since we know our low-income families are at particular risk in terms of developmental delays, or that we know that children who are experiencing ACEs are at risk, having families that are either low-income families or have elevated ACE scores, if we're doing ACE screening in the office, might be a priority for this kind of intervention. There's nothing that says that's magic about doing this at 9 and 15 months of age. It can be done earlier if you think it's appropriate. The program really carries up through age 2. And then by documenting the visit, we can then bring up the issues that we talked about in subsequent well-child encounters. And mostly, I've been finding that this is a lot of fun. I actually learn a lot about the families that I don't often see when we have a more rushed well-child visit. We get a glimpse into their home life, and I think most families seem to be eager to learn about this, and I think it's a nice, I find, relaxing way to integrate a session into a busy office day. So. This is my email if people have any questions or feedback about the program. And the entire program sits on the Maryland Academy of Pediatrics website, and that's the link if people are interested in learning more about this. There's videos, there are parent handouts on there in English and Spanish, and this particular PowerPoint is under professional resources. So I will stop here.
Thank you, Dr. Tellerman. I can tell by the chat and the Q&A section that we have some questions and comments for discussion. I really appreciate that. But I'm going to jump right in so that we are sure to give some time and attention to what's come in over the chat. Let me first, so there was some question here about incorporating ACEs into developmental coaching, even in a telehealth platform, since parental ACEs may affect the child's development. So I don't know if you have comments about that. And then the question also acknowledges that California is already allowing for the reimbursement for screening for ACEs. So comments about that?
So, ACEs screening has gotten a lot of, attention over the last number of years now. We do uncover things that by doing screening. I haven't tried to do ACEs screening in a telehealth visit. Typically parents are asked to fill out a questionnaire ahead, and then opportunity to review the questionnaire. That may or may not be more appropriate for an office visit. What I'm trying to do with these visits is really kind of create a positive session, sort of as a counterpoint to some of the what's wrong approaches that we often take when we are dealing with families. So in an office visit, the classic medical model is often looking for things that are wrong. I like to keep this and preserve this as a positive opportunity. So I use the sessions in that way without trying to get into all the other baggage that may go along with the family. But I do think it's important to screen. I'm not sure that, but if people want to try it out, there's nothing wrong with it. But I think it might detract from the real focus of what the coaching session is about if we bring in all kinds of other sort of more negative things into the picture. But there's no reason not to screen kids during a well-child visit. And there's different ways to do that. One of the things that some people are advocating now are just having parents count up the number of items that they feel are positive rather than actually check off all the items that are positive. And the reason, and it keeps the parents some confidentiality in terms of how comfortable they are sharing that information. If they have a good relationship with the provider, then they might be willing to disclose more. We have to be a little careful about, opening up a can of worms if we don't have a good, ongoing relationship with families. And some families are a little put off by when we ask those kinds of questions. If we don't really already have a good relationship with the family, and some families come away with, that feeling that it inappropriate. It wasn't what they were expecting. So we have to be a little careful in terms of how we contextualize doing ACEs screening, and it really should be done in a setting where people feel supported and not being probed.
Can I, so there are a ton of questions. I'll try to be efficient.
Okay.
Related to that, Dr. Tellerman, there was a question that came in really to the point you just were touching on. How can we ask parents questions about social and emotional health and better support families without pushing them away?
Right.
So I don't know if you found strategies to do that. You were just getting to that point that of being careful and supportive.
Yeah. I always ask families, one, they need to know that you're open to that kind of, interchange. Sometimes, depending on how long the visit is, we're, again, cramming a lot of stuff into, 15, 20, 30 minutes. If there's time that's adequate to explore it, what we don't want to do is have parents start to share and disclose something and then just shut the meeting down and say, okay, well, now we have to go to vaccines. So we want to make sure there's time, and or if a parent does disclose something, that if there's not time in that session to explore it, either one, have them come back and set up a separate visit to talk about it, and I do that frequently. So it sounds like, there's some other issues that are really pressing in your family that we should be talking about, and I really don't want to rush through them right now. Would you be willing to come back and talk about this some more? And that could be set up as a telehealth visit and or an office visit. I would say in the last 6 months, we've been doing a lot of mental health work with our families by telehealth, and it really works very well as long as the families feel safe and comfortable in their home environment. But yes, asking the questions and always raising, what concerns do you have about your child is a really nice way of, I think, just opening up, things for parents to talk about. And then again, making sure that if something is addressed, that it's followed up on, and that the family's not left dangling with having brought something up and not having any sense of closure.
And a couple specific questions have come in about kind of what to do, or have you ever, so I'll try to tie these together as one, but in the coaching sessions and then also in general, so a couple of questions I'm going to link here. Have you ever screened, what do you do when you screen for, or have you picked up on concerns that are specific to the parent? So things like maternal depression or emotional needs of the parent. So there's been a group of questions about this, but if you don't mind speaking to that.
Yeah, sure. So when we were using the toys in the office, you could get a really interesting sense of a lot of things. And we're trying to replicate this through the home visit, but particularly we had much more experience now with the office-based visits in terms of bringing a toy. And one of the things that we're talking about is maybe asking parents to bring toys in of their own now, since we really can't use office toys at this point. But the toy does a couple of things. It lightens the session. It creates a much more positive environment. It keeps the children relaxed so that the parents aren't distracted and can actually talk. But what it does is, one, it gives you an opportunity to informally do it, as we were saying earlier, developmental surveillance. So I'm using the same profile of development, that developmental narrative that we talked about, to see if is that 15-month-old in my office using their legs? Is that child having receptive and expressive language? Am I, do I see them when I hand them a toy playing with it functionally? So it gives me a quick sort of sense of whether they're on track developmentally. We still do our developmental screening, at 9 and 18 and 24 months, but it gives me a kind of a quick picture on those other visits as to whether the child is at least in the ballpark. It also gives us a chance to watch the parent-child interaction. If the parent is engaging with their child, are they giving them positive feedback? Is the parent warm and nurturing? We talk about taking the temperature of the room. Is it a kind of a warm and feeling that you're getting that's emanating from the family? Are you getting a sense? Is it cold? Is the parent shut down? Can you see that they're depressed? They look flat. They aren't engaged with their children. Are they angry? Are they yelling at their child? Are they impatient? All this kind of gives us some clues as to what's going on in terms of that attachment and how they're faring at home. And the office gives you a little kind of glimpse into that world. If I see a parent that's extremely angry or really depressed, that would be an opportunity to say something like, you really seem a little bit down today. Is everything, can you tell me what's going on? And that, at least we open the door. Everybody's not going to jump at taking that opening, but some will. I would also say that we have some of our videos on our website dealing with maternal depression and how you might approach a mother who really seems shut down. So those kinds of things can be picked up on when you're cued into it. When I ask trainees to go into a room and tell me what they observe, most people come out sort of blank because they don't have any real sense of like, what am I looking for? But by creating a platform like we have with the developmental narrative and thinking about, looking at how parents are interacting with their kids, it gives us something to actually look for, and then we actually see things in a more organized, systematic way. So we can kind of train the eye to make these observations, and after a while, it becomes second nature.
So just a quick housekeeping item. We're at 3 minutes to 1:30. If you're willing, Dr. Tellerman, we could take a couple more questions. It might push us
Sure.
over the edge. I just want to be respectful of the time, and Jamie, we can be sure to add the links to the AAP website in the chat again, so folks could be directed to those videos because they are a really wonderful and rich resource. I think that would be great if folks haven't seen them to take a look at those. And I don't know, we've gotten a couple questions. Dr. Tellerman, if you could go back to your the slide that had your contact information on it. A couple folks have asked if they could see that again.
Sure.
That would accomplish, check off a couple of the requests we've gotten here. And if not, we can certainly make sure everyone can find that on our website. All the slides will be available next week. And please keep an eye in the chat because Jamie will be, and Chelsea, adding additional information about the conclusion of the webinar. We have a billing question that I want to be sure I put to you as we're coming to the end of our time. Thank you again for everyone that has joined us. But we have a question here. If you have found issues with reimbursement based on when the patient has had their well child visit, for example, have any payers said this type of visit should have been part of the well child visit and then been an issue when it comes to reimbursement? So
far not. So far not. Because we're using different codes and billing it as a counseling service. So I haven't seen that happen yet, but I do anticipate as we see more and more patients, we're going to get more pushback from insurance providers. And we're prepared to kind of go forward and try to get this, particularly because we're looking at programs that address health disparities, racial disparities. This is something that really is, a politically hot item right now. And I believe that this kind of intervention really supports, families who don't have access to these services. And if we're gonna put our money where our mouths are, and make this sort of available universally to families, I would say most of us may spend a few moments in our child visits talking about development, but it really doesn't get the full attention it deserves, because there's so many things that we have to talk about in a short amount of time, and particularly for families where this is so important, that having a separate session, particularly for our higher risk families, makes this really critical. Let's see if I can I'm trying to bring back the PowerPoint.
Oh, well, we can be sure to get that information out to folks. And I'm mindful we're coming to 1:30, so just so you know, Dr. Tellerman, oh, thank you, there it is. Comments about how helpful Tele has been, especially during COVID. A question about reach out and read, if you're using that. So Jacqueline, you commented on that. I don't know if you want to share any additional information. I know we certainly have talked to lots of folks who are using reach out and read. I don't know, Dr. Tellerman, if you're participating with that or want to comment on that.
Yeah, no, I think Reach Out and Read. So Reach Out and Read is a wonderful program. And, incorporating, since we're talking about the material that we talk about in this program, is basically what people would talk about in Reach Out and Read. If you're involved in the Reach Out and Read program, handing the parent a book, to bring home, or, again, giving the parent a book that's new that they can take home, it can also be used during the session to make some observations and give the parents feedback if you were doing this in office. So I think it's a great program, and I would encourage people to do that. There's other programs that are out there also that allow families to get access to free books, like the Dolly Parton program. Parents can sign up for and they have access to free books, encouraging parents to use the library. And Legos has their own, prescription for play project, and are sending pediatric offices that sign up little clusters of Legos that can be handed out to families. At Hopkins, we came up with a Thinking Outside the Blocks program and actually handed out little wooden blocks. We got a grant from the Children's Center and handed out a little bag that says tree on it with little wooden blocks that the parents could bring home. The wooden blocks can cost like 10, 15 cents a piece. So they're another wonderful way of getting parents to engage and play with their kids. And if they look at the website, Thinking Outside the Blocks is our video that we have, one of the videos we have on there. And we have like a 3-minute video for parents that talks about everything you could possibly imagine that you could do with blocks with children under 3. So I would encourage people to either look at it themselves, show it to families. It can be shown in waiting rooms, and it's very cute. So, and I can't seem to find the PowerPoint that I just had, so I'm sorry.
That's okay. Thank you, Dr. Tellerman. I think the last question, and I know some folks have left, but we have some still here, is from an early intervention physical therapist in Anne Arundel County working with infants and toddlers. They are also a coaching model. She says the frequencies of their visits are very different from a traditional medical model, since they're empowering parents to play an integral part in treatment.
Right.
Outcomes are very positive since doing telehealth. Do you also find more successful outcomes in your patients' milestones by empowering the parents through a coaching visit?
Well, this is something that we're actually studying right now. So we don't have any data at this point to say, yes, this is really changing the way. We have a study that's being completed that was done using the tree at University of Maryland and Sinai hospitals with pediatric residents, and we're finalizing the data right now to see if the parents at the intervention site report doing more of these activities with their kids. We have a grant application in to look at the telehealth program to see if it makes a difference in terms of how parents engage with their kids. So I don't have the data to support that yet, but based on programs like Reach Out and Read, we feel that taking the time to deliver this kind of message should, empirically get parents to at least be thinking about these things more and hopefully doing some of these things. So yes, stay tuned. We hopefully will have some more data, over the next few months, at least on the TREE program.
Wonderful. Well, thank you, Dr. Tellerman, again for joining us this afternoon and sharing your expertise with us and the TREE program. I think we've covered all the questions. I appreciate you sticking with us a few extra minutes, and to all of our participants for hanging on a little longer. Keep an eye on our newsletter and our website for upcoming BHIPP resilience breaks. And please, of course, we always ask that you indicate in your evaluation if there are additional areas of content you'd like us to cover. I see a question. Yes, certificates will be coming out next week. So CMEs and CEUs will be coming out next week. And there was a link for the survey that I saw Jamie sent by. So thank you again, and have a good rest of your afternoon.